Amy, can you describe your symptoms?
I had always had headaches, lots of jaw and neck and headache pain. I've always had tension headaches.
Can you describe these headaches?
They were migraines. I mean, full-fledged migraine, knocked me out, put me in a dark room, put an ice pack on my head, leave me alone, sometimes take me to the emergency room, kind of.
Did they affect your life?
Oh yeah, oh yeah. I mean, definitely. I was always afraid to travel. So one of the things that definitely put a limit on us was traveling, because I never knew when I was going to get a headache, right? And I never knew when I was going to get a migraine. And when you're in the middle of Southeast Asia and you get a migraine like that, there's really not a lot that you can do.
Were you taking pain medication?
I was taking pain medicine every day.
What were they?
A hydromorphone. I was taking, which was called Opana. I was also taking Percocet on top of that, and Soma, which is a muscle relaxer on top of that. So pretty heavy-duty medication.
What kind of other treatment did you have to try and help your headaches?
I saw neurosurgeons over the years. I saw any kind of migraine specialist I could get my hands on. I saw acupuncturists. I saw massage therapists. I saw just about any doctor I could possibly get in to see. I have seen dentists throughout my life who have toyed with different regalia as far as mouth gear for grinding my teeth, and I've also seen eye doctors who have, given me different prescriptions for eyeglasses to help me with my vision, thinking that my vision was part of the problem.
What did the LVI dentist tell you?
He suggested, the first thing he suggested was getting me into a more permanent kind of a mouth guard that would start moving my muscles around, which would relieve some of the pressure around the spots where I was pushing the pressure that was causing a lot of the pain that I was causing. Because after doing a lot of x-rays and looking at those x-rays, there was no, and forgive me for not knowing the clinical terms, but there was no clinical reason for me to have this pain, right? There was no infection or anything like that.
Did his explanation that your headaches were a muscular problem, did it make sense?
Yes, because I didn't have any other. Yes, I didn't know that there was an answer for anything else, and there had to be an answer for something.
How long did it take for this mandibular repositioning orthotic to work?
Right away. Like, it was just this release of tension in my jaw and in the back of my neck, and it was like almost like this sensation. If I noticed that I wasn't waking up with my headaches. That was the biggest thing for me, would be waking up with these headaches, which is the worst thing in the whole world for somebody who experiences headaches, is to wake up with them first thing in the morning, because you want to start your day out fresh. And I would have this orthotic, and I would wake up in the morning and I would not have this headache, and it was the most amazing feeling in the whole world.
How are you feeling today after having your bite changed?
Today, I feel great. I feel really good. I'm really excited.
How long have you been pain-free, no migraines?
At least 6 months. At least 6 months.
That's amazing.
If not longer.
What difference has this made in your life, Amy?
It makes a huge difference. I'm not on drugs anymore, which in and of itself makes me function. I'm able to function like a normal person. I can hold down a job. And excuse me, I get emotional about it because it was so important to do.
What would you like to say to other migraine sufferers?
It's funny because I'll talk to people and they'll ask me what I'm going through and if I have any advice for them and what that advice is. And find yourself a really good neuromuscular dentist who can work with them now.
Just to let you know, you are why we do what we do at LVI.